Thanks so much, Jen. Thanks everybody for joining us. I will very quickly turn the floor over to Mitch Hescox. But before I do that, I want to let folks know on the webinar that if you would like to ask questions, you can type your question into the Q&A chat box. And when we get to the end of the presentations, we will read those questions off to our experts. We appreciate everybody taking time out of their very busy schedules to be with us. Let me turn the floor over now to Mitch Hescox. Mitch.
Thank you very much, John, and welcome everyone, and good evening. I am the Reverend Mitch Hescox, President of the Evangelical Environmental Network, and on behalf of the entire HealthFirst PA Coalition, we'd like to welcome you to our webinar on methane pollution, what experts say about climate change and public health. Today, you're going to hear from three fantastic speakers who I'll introduce in just a moment. But just a little bit about the HealthFirst PA Coalition. It consists of healthcare professionals, public health advocates, parents, faith leaders such as myself, who are all concerned about the impact on pollution on human health and especially children's health. And especially tonight, I would like to give a big shout out and thank you to Vanessa Lynch from Mums Clean Air Force, who did the bulk of the work of organizing this and pushing us all forward, and also to Scott Smith from the Southwest Pennsylvania Environmental Health Project, another key ally and another big planner of this event. And so with that, I am going to briefly introduce our speakers and then set the stage for this evening. First, we have with us from Boston College, Dr. Philip Landrigan. Speaking second will be Dr. Pune Saberi, another pediatrician and practitioner here in the state of Pennsylvania, and Dr. Ned Qatar, a retired physician but very active in the environmental health movement. So why we're here tonight? We're here tonight because over 300,000 children live or go to school within a half mile of a natural gas facility. We have over 1.1 million tons of methane escaped from the natural gas industry. And we are so concerned about the health impacts of that we're here tonight to really develop that and work that. And one of our big concerns is currently Pennsylvania's Department of Environmental Protection is working on a new standard to reduce the amount of VOCs, volatile organic compounds, and methane that leaks from the wells. One of the problems with that standard, quite honestly, as it sits right now, is there is a loophole for the low production wells. And these low production wells are responsible for over half of the emissions coming out of the oil patch. So with that, we're going to get started tonight. And also just as a reminder is that this coalition turned in and responsibly gave over 28,000 comments on this rule from the Evangelical Environmental Network, and then 38,000 in total were given. And so with that, I am going to introduce my friend and my colleague, Dr. Phil Landrigan. Dr. Phil Landrigan, to those in the environmental health field, is no secret at all. He is, in my opinion, one of the world's leading experts and champion. In his retirement, he is now the professor and director of the Global Health Program and Global Pollution Observatory at Boston College. One of his early days in work was he and a colleague were very much responsible for removing lead out of gasoline. He has worked extensively with me on mercury pollution in the days. And in full disclosure, Dr. Landrigan is a member of my board of directors and our chief medical advisor. And so with that, Dr. Landrigan, we're going to turn it over to you for your comments. Thank you.
Thank you, Reverend Mitch. Thanks for inviting me, and I'm delighted to be here with my two colleagues. I think it says something very powerful tonight, that the three speakers talking about methane, which of course is the main constituent of natural gas, are all medical doctors. We're not environmentalists. We're not climate scientists, we're medical doctors. And the reason we've come together is because we want very specifically, as Reverend Mitch said, to talk about the impact of gas and fossil fuels in general on human health. So without further ado, could I have my first slide, John? Which is my title slide. There we are. There we are. So that's the there you are. So that's the title of that's the official title, Pollution, Climate Change, and Public Health. And if you'll click The second title, the subtitle, is The False Promise of Natural Gas. And I'll come back to that theme in a couple of minutes. But first some basics. So this is pollution. This is what pollution looks like. And by the way, this picture was taken not in some faraway country. This picture was taken in Cleveland, Ohio in 1968 when I was an intern at Cleveland Metropolitan General Hospital, just a few months out of medical school. This is what the air in Cleveland and, of course, in much of Pennsylvania at that time looked like, just approximately 70, not that long, 50 years ago in this country. And this is a definition of pollution I put up on the slide here. It's material produced by human activity that is released to the environment and endangers human health and ecosystems. And the next bullet is that pollution is a major threat to public health. And the next bullet says that pollution is a generic term. It includes air pollution, water pollution, and toxic material that's dumped directly on the land. Okay, the next bullet. So I was the co-leader a couple of years ago of an international consortium called the Lancet Commission on Pollution and Health. Lancet's a major medical journal published in London. And we were charged with looking at the impacts of pollution globally, all forms of pollution. And these are our main conclusions, that around the world each year, at least as of 2015, pollution was killing 9 million people per year. That's 3 times more than AIDS, malaria, and TB combined. It's 16% of all deaths worldwide. And the next bullet will tell you that it's 10 times more deaths than all the wars, the terrorism, and all the different forms of violence that we see on TV and read in the newspapers every day. Next slide, please. So let's look at this. If you'll just click through this, John, like about a 5-second beat between each click. And what this slide is doing is comparing pollution against Ebola, against war, against road accidents, against, I can't even read it. The next one is AIDS, malaria, and TB. The next one is diet high in sodium, salt. That's one there is tobacco. And then the last one, if you bring that up, the red one, that's pollution. You can see that pollution is a very important cause of disease and death, killing more people than tobacco, more people than road accidents around the world. The next slide makes the point that pollution is a major cause of chronic disease around the world. Pollution, and this is mainly air pollution, accounts for about 1/4 of all cardiac deaths, 1/4 of all stroke deaths, half of deaths from chronic obstructive lung disease, COPD, and 40% of lung cancer deaths. So it is a major cause of disease. I think back when I was in medical school, we understood that air pollution might cause a bit of wheezing and a bit of bronchitis. But it's only in the last 10 to 15 years that we've come to realize that pollution causes this wide range of disease. And even more recent information indicates that pollution is now strongly linked to diabetes, and it may in fact be linked to the early onset of dementia, Alzheimer's disease. This is information that's just now coming in. Next slide, please. Children. We're all pediatricians, all 3 of us, and so it's important if you'll click the next button. I make the point that children are exquisitely sensitive to pollution. They're more heavily exposed to pollution, pound for pound of body weight, than adults, and their little bodies, their little organ systems are growing and developing, and all those complicated, very tightly scripted processes of growth and development create enormous vulnerabilities. And we now know, if you'll click the next couple of buttons, John, that early life exposure to pollution, even exposure in the womb by way of the mother, the pregnant woman being exposed, can trigger asthma in children, and the mother's exposure can lead to premature birth and low birth weight, which we all know carries a raft of complications that can extend through childhood and even across the whole lifespan. Okay, next please. Pollution and climate change. I think of them as evil twins because they share a common mother. And the next bullet tells you what the name of that mother. The mother is fossil fuel combustion. It's the burning of coal and gas and oil is the major source of air pollution in every country, in this country and in every country around the world. It accounts for 85% of the airborne particulate pollution, the fine particles known sometimes as PM 2.5 because they're less than 2.5 microns in diameter. And it also accounts for pretty much all, all pollution by oxides of sulfur and nitrogen, And at the same time as fossil fuel combustion is causing air pollution, it's also generating CO2, carbon dioxide, and the other greenhouse gases that drive climate change. So the good news here is that anything we do to solve air pollution is going to reduce the pace of climate change and vice versa. This is what is referred to as co-benefits. It's sort of like a double benefit for the same action, something that a lot of people in Washington don't like to talk about these days because they don't like to give us credit for doing two good things at the same time. But the fact is that when you control one, you control the other. Next slide, please. Now, I said I would say something about the false promise of natural gas. This beautiful picture of a brand new tanker ship sailing across a pristine sea is an advertisement I saw in an airport. And as you can see up at the top, it talks about natural gas, investing in natural gas to reduce the carbon footprint of the global energy mix. Basically, they're putting out the argument, which I believe is a totally false argument, that if we switch to natural gas, we'll reduce the carbon footprint. Let me tell you why I think that argument is false. What's the truth behind this beautiful glossy picture? Next bullet, please. Promise versus reality. Next, please. So let's talk about the hazards of natural gas. Natural gas, which of course methane is the major component, has hazards at every single stage of its life cycle. So starting with fracking, and I know my colleagues are going to say more about fracking because it's a much bigger problem in Pennsylvania where you are than Massachusetts where I am. But nonetheless, there's plenty of information out there. So this slide summarizes the many hazards of fracking, of the actual drilling and the extracting of gas. Water pollution, air, noise, light, radiation, earthquakes, ecosystem damage. The next slide talks about the hazards of the pipelines and the compressor stations that are needed to move the gas from the wellhead to the market, to the tanker ships, wherever it goes. And the most notorious hazards of pipelines and compressor stations are fires and explosions. There have been major explosions, including explosions in Pennsylvania. A year and a half ago, there was a big explosion in Massachusetts in the towns of Andover and Lowell, which are in the Merrimack River Valley north of Boston, took out 100 homes, sent about 30 people to the hospital, including a couple of firefighters, and killed one high school student who was coming home from his second job, was in the wrong place at the wrong time and was blown up by this gas leak. And nowadays, and that was basically a low pressure pipeline that blew up in the Merrimack Valley. Nowadays, gas lines are being pressured to much higher levels than that line was. And of course, when the gas is more heavily pressurized, the explosion will be that much more powerful. Also, there's a lot of social injustice linked to pipelines and compressor stations. They're never put in rich neighborhoods. They're always put where poor people live, where people of color live, where people that have weak political voice, where the pipeline companies and the fossil fuel industry reckon they can get away with it. Next, please. And then in addition to the fracking hazards and the compressor station hazards, natural gas has a very serious impact on the climate, entirely contrary to that glossy photograph I showed you a couple of slides back. The biggest contribution from natural gas is the methane leaks that Reverend Mitch talked about. Somewhere, depending on how you count it, somewhere between 4% and 8% of all the gas produced in fracking is lost. It just goes up into the atmosphere. And we have seen a major increase in levels of methane in the upper atmosphere in the past decade. And the problem with the methane that goes up into the air is that it's between 30 and 80 times more powerful than CO2 in driving climate change. And it persists. It lasts for decades up there, warming the earth like a great blanket. So across the bottom line is that across its life cycle, natural gas is nearly as dangerous as coal. And we just cannot pretend that natural gas is a safe, clean fuel. It is not. Next, please. So Reverend Mitch wanted me to say a few words in closing about the fact that climate change is now happening in the United States. So the next few slides will quickly take us through that. Heat waves, hurricanes, rising sea levels and coastal flooding, a real problem up in New England where I am. Wildfires, California, droughts in the western US, melting glaciers, which are contributing to the rising sea levels. And the next couple of slides are just pictures. This is New Orleans during Hurricane Katrina, probably the first big signal in the United States of the of coming attractions of climate change. Next is a picture of the wildfires in California that we've all read about this year. Next is drought. This is in the southwestern United States. You can see that the old reservoir is, the current reservoir is way below the historical levels. Next. And I want to close with this. A lot of times we hear statements about how pollution control kills the economy, destroys jobs, is bad for America. That's a lie. It's just an absolute lie. It is not supported by the facts. And this little graph explains what's going on here. If you look at the line that this graph covers the years 1970 to 2017. We chose 1970 because that was the year that the Clean Air Act was passed, which, by the way, was signed into law by President Richard Nixon. And since we passed the Clean Air Act, that lowermost line on the graph, the line that is tending downward from left to right, shows what has happened to air pollution in this country since 1970. Air pollution in this country since 1970 has come down by 70%. The kind of air pollution I showed you in my very first slide that used to exist in cities like Cleveland is a thing of the past in this country. You still have it in China, still have it in India. But in this country, we have knocked down air pollution by 70%. At the same time, if you look at that green line, the top line that's going upward, that's the line representing the American economy, the GDP, the gross domestic product. And if you click one more time, John, you'll see that in these 50 years since 1970, the GDP grew by 250%, by 2.5 times, while air pollution fell by 70%. So anyone who tells you that controlling air pollution stifles the economy is wrong. They're lying, they're making up facts, and they're trying to spin you. And the truth of the matter is that pollution benefits the economy because it keeps people healthy, it keeps people productive, it restores ecosystems, and it's just the right thing to do. So thank you. I will now be quiet and turn it over to my colleagues.
Thank you very much, Dr. Landrigan. Dr. Phil, I call him EEN's Dr. Phil, and so we're here, but we're going to quickly turn to Dr. Pune Saberi, who has been a physician for 20 years, currently specializing in occupational and environmental studies. She received her medical degree and Master's of Public Health at Tufts University up in Boston. She had practiced family medicine in the Philadelphia area, and she is the immediate past president of the National Organization of Social Physicians for Social Responsibility, and currently is the Pennsylvania president. And so with that, I will turn it over to Dr. Saberi.
Thank you so much, Reverend, for that. It's an honor to be on this panel with Reverend Hiscox, with Dr. Landrigan, with Dr. Qatar. It's understandable. My specialty is actually occupational and environmental medicine, but I did practice family medicine for 10 years, so it was full spectrum practice, and I did take care of children, so children are definitely near and dear to my heart. But for this panel, I was asked to explain what causes climate change. So we can go to the next slide. And often, I don't think John is controlling them. Great, perfect, thank you. So there is a natural greenhouse gas effect that happens where when the sun shines on our beautiful planet, the solar rays reach the surface of the earth, and then a portion of them get emitted back and they go out into space. But please click next. What happens when we have a human-caused greenhouse gas effect is where we have a buildup of these molecules, these greenhouse gases in the atmosphere. And these molecules have the capacity to hold on to that wavelength that is the heat of the sun, the wave of the sun rays. And then what they do is they hold on to that heat. And so the sun rays no longer dissipate into space, but rather stay in the atmosphere, and they build up, and you have this kind of ping pong effect that later on leads to kind of like a wool blanket in July type of phenomenon. And so when we talk about this kind of human-caused greenhouse effect, we're talking about the picture that's on the right-hand side. Next slide, please. Generally, when people think of greenhouse gases, they think about carbon dioxide. And of course, carbon dioxide is the main greenhouse gas that's released in the process of the many activities, the human activities, and kind of what's needed in the generation of energy for these activities. Please just hit one more. There you go. There are other very important greenhouse gases. And in fact, methane is the second largest one. And as Dr. Landrigan explained, in the short term, it has a much higher driving force on climate change. Next, please. Okay, and so when we talk about methane, often methane and shale gas or natural gas could be used interchangeably, because methane is a colorless, odorless greenhouse gas that's responsible for about 25% of the current global warming effect. And it's the main component that you would find in shale gas or natural gas. And essentially the oil and gas operations are the largest industrial sources of methane in this country. And it's the and originally it was proposed as it was kind of sold as this better alternative to coal, because it was thought that at the point of burning, it burns cleaner. But it turns out also, as you saw, that there's methane leaking from the entire life cycle, from the wellhead to the end user, that really has a large impact on climate. Next slide, please. And you can actually click one more, because unlike what was originally essentially promoted, the impact of methane is not just at the point of combustion. It's happening at the extraction level, the processing, the transportation. And you can see that methane, the fugitive emissions from methane, are the ones that are largely contributing to the buildup of this greenhouse gas in our atmosphere. Next slide, please. So it's also true that methane emissions are supposed to be reported, and there would be the information, the data is gathered by the EPA. But it turns out that the true scope of methane emissions is much, much more than what is reported or what is estimated. For example, just last week, the Environmental and Science Technology put out an article that showed that the Permian Basin, and the basins are kind of essentially the shale plays, you know, that where extraction of these of gas and oil happens. And so the Permian Basin, which is in New Mexico, the methane emissions are 5 to 9 times more than what was estimated by US EPA. And then here in Pennsylvania, that's part of that report, Environmental Defense Fund concluded that the oil and gas related methane emissions are 15 times higher than what the industry reported. We also have another problem in Pennsylvania, and these are the abandoned wells. Because we have a lot of legacy wells that were used for, conventional extraction. And these wells, after 30 years, 60% of them have, leakage because they're not being used anymore, and 50% after 15 years. Next slide, please. So here, what I'm showing, if you look at the top left-hand graph, is that US has increasingly become the largest gas producer in the world. And then if you kind of move down to the chart of the image at the bottom, you'll see that Pennsylvania is the second largest producer of gas in the United States. And then the top right-hand one shows that the gas systems are by far and away the largest emitters of methane in the United States. And so if we put this all together, we can see how much Pennsylvania contributes significantly to methane emissions, and therefore to driving climate change. Next slide, please. Right, and then so here you can also see that the leakage from the Marcellus Shale is in fact as much and maybe even more than coal as a driver and as a global warming potential towards climate change. Next slide, please. Okay. So the point of that is that, about 10 years ago when, natural gas was a big, essentially was promoted in Pennsylvania, one of the thoughts behind it was that it could be a bridge fuel. But it turns out that it is not a bridge fuel. And in fact, it has been contributing significantly to climate disruption and is therefore the cause of many health hazards of climate change, which I think we're going to talk about later. It is a significant, and essentially the extraction, the production, transportation is a significant contributor to air pollution, as Dr. Landrigan explained. And then you'll see how it's not better than coal. It could possibly be worse. But beyond all of that, the point is that there's much better alternatives that exist these days now, technologically, that are also good for the economy. Next slide, please. I also was asked to talk a little bit about what climate change means for us locally. And I live in Philadelphia, and you see this is a map of Philadelphia. And it turns out that among the photos that you saw that Dr. Landrigan showed, in the Northeast and the Mid-Atlantic regions of the United States, becoming hotter and wetter is what we're going to is going to be the gift of climate change to our region. So in fact, July 2019 was the hottest July on record for the city of Philadelphia. But it turns out that not all places were equally hot. In fact, the parcels that you see, the redder that they are, that means they were hotter than the yellow and the blue ones. So you can see that the heat did not impact the city in a uniform manner. Now, remember this map, because if you click next, the map on the left here shows you the zip codes based on the health outcome rankings in the city of Philadelphia. The health outcome rankings were based on quality of life and length of life. So essentially, the lighter kind of, turquoise is a higher quality of life and longer quantity or length of life. And the ones that are, darker and bluer are kind of in the bottom tertile in terms of quality and quantity. And if you recall, many of these zip codes that are darker correspond to the areas that were hotter in the previous slide. You will also see on the right-hand chart that these are numbers for asthma hospitalizations for children in the city of Philadelphia. You will see that asthma hospitalizations vary greatly based on race. So Black and Hispanic children were much more likely to be hospitalized for asthma in 2018. And then below, you will see that if you had Medicaid as insurance, you were much more likely to be hospitalized. And so what I'm trying to demonstrate here is that climate, health, race, and income are inextricably connected, and they can't be addressed in their own separate silos. And then last slide, I believe, is the next one. Right, so the last slide essentially reiterating that hazardous environmental exposures are exacerbated by social determinants of health, where you live, housing, access to services. Environmental protection is not just a matter of health. I know we're all medical doctors, but we're all very aware of the social justice and the equity issues that go into this, the climate justice issues. And that Pennsylvania Article 1, Section 27, the Constitution, has a very, very important message, which says that clean air and safe water are the rights of every Pennsylvanian, and in my opinion, they should be recognized as a human right. And with that, I'm going to end and pass it on to my colleague.
Thank you very much, Dr. Saberi. That was excellent. And one of my board members who lives in the Upper Darby area, a Bywood community there, who's a Black pastor, often refers to Philadelphia now as Swedelphia, because of the increased heat index and the lack of trees. So thank you so much for that. Our final speaker today, and certainly not the least, is Dr. Ned Qatar. He's from Pittsburgh, Pennsylvania, recently retired as a pediatrician. He still is a member of the American Academy of Pediatrics Council on Environmental Health. And in clear disclosure, he's also a consultant that works with the Southwest Pennsylvania Environmental Health Network or project. We are so glad that he is here, and he's going to be talking about his experience in living close proximity to the rapid expansion of shale gas. And so without further ado, Dr. Ned, it's yours.
Thank you, Reverend Mitch. I appreciate that. I appreciate being on this terrific panel tonight. I'm honored to be here. I'm going to be talking about how methane and VOC emissions from fracking harm health. Pennsylvania is now ranked #2 as a natural gas producer in the United States. And fracking is inherently dirty and dangerous, and it risks the health and the safety of residents living, working, and playing nearby. Harmful pollution is generated at every point of frac gas infrastructure, from the super well pads today that can hold dozens of gas wells on them, to compressor stations that move gas along the pipelines, to enormous processing plants, while all along the way emitting copious volumes of air pollutants that accompany methane, like VOCs that contribute to the formation of ozone. And we know that pollution doesn't just stay in one place. Winds blow, rivers and streams flow. What goes up in the air as pollution comes down and eventually gets into the air we breathe, and the food and the water we ingest, and ultimately into us. Next slide, please. So the particles, I'm sorry, if you can go to the next slide. Very good, yes. So sadly, Pennsylvania residents and physicians worry about a wide array of air toxics emitted by oil and gas operations. This evening, we'll focus on just two, methane and volatile organic compounds, or VOCs. But when you look at this list, you can see that all of these components of pollution are harmful to health. John, if you could go to the slide right before this one. Very good, thank you. The air contaminants include radioactive particles, which according to a new study published just last week, can be detected in the air with monitors downwind from unconventional gas wells. The Marcellus Shale is highly radioactive. It's a highly radioactive shale formation, more radioactive, in fact, than shale formations elsewhere in the US, like the Permian Basin that Dr. Saberi just showed us. This fact has been known for many decades, but now it appears from this research that living up to 20 kilometers downwind from oil and gas operations increases the risk of exposure to radioactivity above normal background levels. The closer you are to fracked gas and oil wells, the higher the risk of health damage from radioactivity. Next slide, in fact, go 2 slides ahead if you would. Very good. So today we know that massive volumes of methane leak inadvertently and are vented on purpose into the atmosphere during oil and gas operations. Because methane is an extremely potent greenhouse gas, as we've heard, trapping heat in the atmosphere many times more effectively than carbon dioxide. Fracking is a disaster for the planet's climate system. It accelerates climate change. Instead of being that bridge to the future that Dr. Saberi was mentioning, fracked gas is actually a bridge on the highway to climate catastrophe. Next slide, please. VOCs are an abundant component of shale gas pollution. Benzene is associated with birth defects and immune disorders, and it causes cancer in children and adults. Exposure to benzene and other VOCs like toluene can result in permanent neurologic damage. Air pollution occurs at every stage of shale gas development, especially at compressor stations. Nitrogen oxides in particular are released in great quantities from compressor stations. These emissions combine with VOCs in the presence of heat and sunlight to form ground level ozone. Ozone is a potent air toxic that stunts the growth of children's lungs and damages every person's lung function, making it harder for adults with chronic lung diseases and children with asthma to breathe. Next slide, please. So we know that people who live and work and children who learn and play near frack gas sites are vulnerable to environmental degradation and pollution from fracking. And we know now from abundant research in Pennsylvania and other states, and from the grand jury report released over the summer, that people are being impacted and their health is being damaged here in Pennsylvania. It shouldn't surprise anyone that women and children would be at the top of the list of impacted residents. In fact, this list is the same if we're talking about fracking, if we're talking about climate change. The same list of individuals are at high risk. Multiple studies now show that living near fracking sites can complicate pregnancies, resulting in poor birth outcomes like prematurity, low birth weight, small for gestational age newborns, and birth defects, all of which have lifelong consequences. The health risk to infants and children living near shale gas development is especially concerning. Children are not little adults. Their behaviors and interactions with the environment increase the risk of exposure to toxic chemicals. They spend more time outdoors than adults, playing in the grass and the dirt where the pollution settles. And every parent knows that kids shove everything in their mouths, dirty hands and fingers and rocks and toys and food. And everyone knows how hard it is to get kids to wash their hands before they eat. Children's bodies grow and develop rapidly, making their organs and body systems more susceptible to damage from toxic exposures. Exposure to some of the chemicals discharged during fracking operations act as endocrine disrupting chemicals in the body. These have been shown to interfere with children's growth and development and are linked to major problems with cognitive and brain development. Children have a long shelf life, which means that they have years and even decades after exposure to develop symptoms of chronic disease and cancer. And we should remember that poor health in childhood increases the likelihood of poor health in adulthood. Older people and those with limited financial resources are also at risk, as are people of color who often live in environmental justice zones close to polluting industries like the oil and gas and the petrochemical industry. Residents who have existing medical conditions like chronic lung disease, heart disease, kidney disease, mental illness, and children with asthma are at higher risk for having exacerbations of those diseases. Fracking jobs are some of the most dangerous jobs in America. Industry workers who are exposed to physical injury, air pollution, chemicals, and radiation may not have the personal protective equipment and training necessary to protect themselves and their families from harm. And let's not forget our first responders. In the US, the shale gas industry is not legally required to disclose the identity of the chemicals used in fracking operations. This secrecy puts first responders at a disadvantage when called on to respond to an emergency, and it puts their health and safety in danger. Next slide, please. So the pollution from fracking operations threatens the public's health. And instead of being a bridge fuel to a cleaner future, like I said, fracked gas is a bridge on the highway to climate catastrophe. In the 6th edition of PSR's Fracking Science Compendium, which is available online, more than 1,700 peer-reviewed studies and investigative reports found no evidence that fracking can operate without threatening public health directly or without imperiling climate stability upon which public health depends. Next slide. The growing body of medical evidence is sufficient to conclude that pollution from oil and gas operations is inherently dangerous to the health of people, of the environment, and to the planet's climate system. Methane, VOCs, and other toxic air pollution make people and the planet sick. Each of us in Pennsylvania, as we've seen, we have a constitutional right to clean air and pure water. We need, and Pennsylvania's children deserve, the strongest rules possible to limit the damage caused by methane pollution. That means stepping up inspections at all fracked gas sites and examining even low-producing wells that leak high amounts of methane and other air toxics. Governor Wolf's proposed limits to relieve the burden on residents living near fracked gas sites aren't enough, but they're a start. They will allow residents to literally breathe a little easier. They will allow parents to breathe a sigh of relief that the air their children breathe, the air we all share, is cleaner. Next slide, please. From our cradle to our grave, our health is threatened by air pollution from oil and gas development. Fracking scars the landscape and degrades the environment. It contaminates the air and the water and the soil we all depend on to sustain us, and it makes us sick. And fracking accelerates climate change. Children have the most to lose if we don't change, and the most to gain if we do. As a pediatrician and a father, I know that children live in a world shaped by our choices. For our kids and our grandkids, a safe and healthy future depends on how wisely and how quickly we choose to act responsibly to protect the health of the planet and all its inhabitants. Thank you very much for listening.
Thank you very much, Dr. Qatar. That was excellent. And all three of our presenters were just spot on tonight. And so thank you very much. And if we can go and have all of our presenters up, including myself, I'd like to enter into sort of a discussion between all three of you. And we'll hopefully get some questions in from our audience who are listening. But I'd like to start out with, I guess, one of my own pet concerns is, and how do we solve it from your point of view? And I'll start with Dr. Landrigan. But when I talk to the general public, which I do, and before COVID, all around the country, and still do by Zoom around the country, there is a total lack of awareness of the health impacts of pollution. They think, and so when I mentioned that 120 to 200,000 people die in the United States from soot, PM 2.5, they say, what are you talking about? And by the same token, when I talk to a lot of family practitioners and pediatricians, they're also so unaware, or at least seem to be unknowing, about pollution's effect. How can the four of us work together, and everybody on the call, that we can get this message across that pollution is a killer, climate change is a public health threat, and methane pollution is serious in Pennsylvania? Dr.
Right.
Landrigan, and then Dr. Ned, I'll go to you next. How's that?
Thank you, Reverend Mitch. Well, I think the way I would begin my answer to this is to ask people to think for a minute about COVID. And what the COVID pandemic has taught us is that tiny particles that we cannot see can make us sick and can kill us. We know that abundantly well. Hundreds of, more than 200,000 Americans have died from COVID from stuff that we can't even see. Well, fine particulate air pollution is the same thing. It's tiny, microscopic sized particles, so small that they can go deep into the airways, into the lungs, and some of them can even cross from the lungs into the bloodstream and then go throughout the body. And given that these foreign particles, which are a little chemical soup, each little particle is a little chemical soup with carcinogens, neurotoxins, reproductive toxins, endocrine disruptors on it. Those chemicals get into the human body. It's not surprising that they cause heart disease, stroke, asthma, premature birth, possibly increased risk of autism, possibly increased risk of dementia in the elderly. So I think part of the issue here is a failure of medical education. Medical schools have historically, with few exceptions, given very little attention to the environmental causes of disease. Doctors have taught about smoking, about alcohol, about drug abuse, about a proper diet, but there may be a throwaway lecture on a Friday afternoon about environmental causes. That needs to change, and the three of us here have all been involved in efforts to bring about curricular reform, actually, in medical schools, so that doctors and nurses and other health professionals become much more knowledgeable. I think that if doctors and nurses understand these basic facts, and they're very basic and they're scientifically very well supported, people trust their doctor. I don't know if they trust the newspapers anymore, but they certainly trust their doctors. And if a doctor says, listen, you got to watch out about air pollution, it's killing your children, it's making your kids sick, people listen, people believe. I think that's the leverage point here.
Thank you. Dr. Ned?
Well, I think that most people in 2020 understand that air pollution is bad. It's bad for your health. It's bad for your parents and your grandparents' health. It's bad for your kids' health. And I think that most physicians in the United States and most nurses understand that too. Yes, we do need more in terms of curriculum in nursing school and medical school. Doctors have a lot of knowledge, though. They understand a lot of this. They don't do a very good job in talking to their patients about it. And I think that's one place where physicians could do a little bit better. You can talk about climate change without using the two words climate change. At every visit, you could talk about, heat waves when it's hot. You can talk about, extreme weather, because we're having lots of extreme weather. I do want to make a point that there are a lot of young physicians, young nurses, young health professionals in other areas that are quite concerned about the climate crisis, that are speaking out all over the country. We need those numbers to grow, but for me as a retired pediatrician, I'm really heartened to see so many young health professionals beginning to speak out and speak out for the health of their patients and their families.
Thank you. Dr. Saberi, would you like to comment on that question before I ask you one for you to start out with?
No, I mean, I think that pretty much everything has been covered. Maybe I'll just add that for me personally, part of it is that often people connect air pollution with lung problems, but this kind of realization that air pollution is actually not, a significant contributor to heart disease, like to cardiac, illnesses, and to the fact that it can, lead to like dementia and anxiety and liver problems. Like there's like, it goes through, it can do anything throughout the body. That's kind of a connecting a dot that, maybe we can do a better job of doing. Number one killer of the people in the United States, heart disease, and air pollution is a risk factor for it. So I would just say that.
And while I have you answering questions, I'd like to ask one, what do you think? What is your opinion about what can we do to protect Pennsylvanians from climate change impacts, its health consequences, and also methane pollution?
Yeah, I often I read about kind of an analogy of climate change, which is that somebody once wrote that climate change is kind of like your bathtub overspilling with water, and when that's happening, you don't reach for the mop, you turn off the tap, right? So so I kind of, I always like, think about that, and so to me, turning off the tap is what we would call mitigation, and then reaching for the mop is what we might say is adaptation. So often kind of in this arena, we're really, I mean, it would be great if we were just in the mitigation, stages, but we're not. We actually kind of also need to mop up a lot of things. So we also need to adapt. And so I would say that kind of the mitigation part would be really moving away from fossil fuels, as kind of we keep reiterating, it's the number one driver. That's what we need to, move away from. We have really good, healthy alternatives, to meet our needs. And there's, a ton of, technology that's been developed, and really the only barrier has been the political will, is to just make it happen. And then I would say kind of on the adaptation front, I think about kind of implementation of infrastructures that contribute to resiliency of a community, and what makes a community or a person resilient are the kind of the social determinants that we talked about, right? Like access to healthcare, affordable housing, jobs. And so that's, anyway, so I would say that, I would like the policymakers to be really cognizant of the fact that we have a very limited time period, less than 10 years, and to really just kind of like push to make this happen for Pennsylvanians, both on the mitigation and the adaptation side.
Great answer. Thank you so much. And we're starting to run out of time, so I'm going to turn directly to Dr. Ned. you live in the largest sort of fracking area in Pennsylvania currently. You've experienced a lot of these health impacts directly in your practice and now as an advocate and teacher. Tell us, about what you're really encountering in the real world, and how can we support your efforts to clean up Pennsylvania and protect our children?
Well, thank you for that question. I think the first thing that you can do, and everybody watching and all of your family, is to vote in 2 weeks from today. I think that is the place to start. I do live in Washington County, which is the most heavily fracked county in Pennsylvania. As part of my work with Environmental Health Project and with my colleagues at Clean Air Council, we take people on tours, on frackland tours of Washington County. We've taken politicians and journalists and faith leaders and health professionals on tours over the past 3 years or so. And I'll tell you, I cannot get through a tour where we're standing above several well pads or right next to a compressor station where I don't come home with a terrible headache, with nausea, with just feeling sick, for hours after that trip. And I've talked to many, many impacted people, people whose health has been severely harmed and who live in a state of stress because of all the truck traffic, all the emissions, all the noise, all the light at night. It just goes on and on. And this is rural. In fact, Washington County is a very, very beautiful and scenic county. And to see environmental degradation and destruction at this rate in the past 10 to 12 years has been demoralizing for people. It's been very disruptive and disturbing. And anytime a person witnesses such environmental degradation and destruction, they're going to have a mental health impact. And that's especially true in children. So we're seeing it here in Southwest Pennsylvania. We're living it. And it's sad to see. And ultimately, Pennsylvanians have to stop with their magical thinking that they can continue to frack for natural gas and frack for plastic, which is what we're doing, and at the same time think that they can have serious climate action. You can't have it both ways. And the governor and the legislature and all the people in power need to understand that. And that's not a political statement. It's not because of politics. It's because of chemistry and physics.
There we go. I'm going to like a wrap up for each one of you. If you could spend just a minute giving your final thoughts on climate change, children's health, public health in general, and what your recommendations are for people on this webinar who are listening to it live and the hundreds that will see it and recorded. So Dr. Phil, you go just 30 seconds to a minute, sort of a final wrap up thought.
Thank you, Mitch. So I would say in conclusion that climate change and pollution are two existential threats to humanity. They threaten life as we know it. If we don't get smart, if we don't stop what Dr. Qatar calls our magical thinking, we're going to destroy everything that we have built. And the greatest victims will be our children and our children's children. God gave us this beautiful planet. It's our job to protect it. We really have to get our act together.
Dr. Sabari?
Yeah, I mean, Dr. Landrigan said it exactly the way, I would say it, that there is many important and beautiful parts of this planet, including, humans and communities and biodiversity that we need to protect, and it's really our responsibility to step up and do it.
And Dr. Qatar for the final word before I get the final word. So
we're talking about our children's future. So let's be positive for a second. We clean up our air, we help the climate. We solve the climate crisis, we clean up the air. That's win, 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 win for our children. It improves their health. It improves our national security. It improves our economy. It improves their outlook for their future. So we have the technology, we have the solutions to solving the climate crisis and to benefit from less pollution. We know how to do it, and we need to get started because, as the scientists have been telling us, we're running out of time. In fact, we've run out of time.
A special thank you to all of the participants, the panelists. You folks are wonderful. I would love to spend personally hours with you talking because this is right in my wheelhouse of what I try to communicate to Christians around the country. So thank you so much. You know, for us, we call it creation care as a matter of life. For everything that we put into God's creation that isn't supposed to be there in its right place, usually comes back to harm human health, especially children's health. And I think you've talked about that exquisitely tonight and just wonderfully. But I do like what you said is that there is a sense of hope. If we literally get off our duffs, excuse the language, and get to work as a nation and come together, we can solve the climate crisis. We can have pure air and clean water. We can have sustainable jobs, clean energy jobs, and all sorts of new things that can happen. But we have to stop living in the past. There is a bright, healthy, cleaner future that provides family-sustaining jobs if we just embrace it and go towards it. And so when it comes to methane, we need to have a strong standard that keeps people from throwing their trash into our yards and into our children's health. It's time people are accountable for wasting things and throwing it away. So we hope the governor will act upon that and move that forward and make a tight standard and close up all the loopholes. But we also need to work on climate change in every aspect. And so from the HealthFirst PA consortium of wonderful people who all have put this together, and especially to our panelists and all who listened tonight, thank you. And even though I probably shouldn't say this or not, God bless to all of you. Take care. Thank you so much.